Vision without action is a dream. Action without vision is simply passing time. Action with vision is making a positive difference. Temple Health and Bioscience District. A better tomorrow, today.
The vision of the Bioscience District I would see as threefold. One, to continue to enhance the educational opportunities in math and science for the kids in our community, all the way from kindergarten up through college. Second, to continue to assist in the building of some of the very superb research programs that our academic partners are already engaged in this community. Thirdly, much of the excellent science that is being conducted in the laboratories of our investigators over here also provides an opportunity to translate some of that intellectual property into entrepreneurial opportunities. In other words, the commercialization of some of this science.
At the heart of this vision, and critical to its success, is a synergy between city, existing bioscience partners, and the community at large. The City of Temple provides both foundational support and leadership through initiatives such as the Reinvestment Zone's Bioscience Park, Temple Medical and Educational District, as well as an ongoing commitment to quality of place and infrastructure. Temple's existing bioscience partners are central to the district's initiative. And these partners, King's Daughters, Scott & White, Central Texas Veterans Healthcare System, and Texas A&M College of Medicine, provide the ongoing delivery of health services, as well as act as an ever-present catalyst for research. The vision of cooperative efforts between the City of Temple, the bioscience partners, and the Health of Bioscience District will provide new educational opportunities with academies and a standalone 4-year medical school. As a result, our community will have an industry-ready workforce, which will be able to accommodate a 25 to 50% increase in essential health and bioscience jobs. With a plentiful labor pool, economic development of Temple's bioscience industry can prosper through the creation of a bioscience accelerator and the recruitment of bioscience startups. With a targeted educational system, invigorated workforce, and a variety of health and bioscience companies, an increase in research initiatives will result along with increases in National Institute of Health funding and Emerging Technology Fund grants. By working in cooperation to enrich educational opportunities, provide a competent workforce, be aggressive with economic development, and increase research and research funding, the community will see the creation of new, higher-paying jobs. And through this collaborative effort between public and private sectors, national recognition will be brought to Temple.
Since the district was created in 2003, a lot of activities have taken place, but one that people can probably relate to the easiest is the West Campus. That was a former TI facility, 500,000 square feet that was vacant. The district has worked hand in hand with our partners, and now you go into that facility and there's the Cancer Research Institute, there is the Center for Regenerative Medicine, both cutting-edge research institutes. You have a medical education side of the equation, the Texas Bioscience Institute that Temple College runs. So in that one facility, you have research ongoing and medical education ongoing.
As a part of the vision, action has been taken with the acquisition of a parcel of land dedicated to the economic development of the health and bioscience industries. Encompassing more than 65 acres, the Bioscience Campus offers up to 15 building sites for health and bioscience facilities, incubators, and entities. With $11 million already committed to roads, development, and infrastructure, the campus will be complete and ready for marketing by fall of 2009. Currently anchoring the Bioscience Campus is the 500,000 square foot Bioscience Research Center. It is home to the Cancer Research Institute, Regenerative Medicine Institute, and the Texas Bioscience Institute, and is an epicenter for research and education. As a result of cooperative efforts between the Health and Bioscience District and its partners, a breadth of educational opportunities now exists to assist individuals in securing their future with better, higher-paying jobs. The Texas Bioscience Institute, winner of the Bellwether Award for Innovation in Health Professional Education, services middle college students, community college students, and bachelor degree level students. The middle college students are comprised of high school juniors and seniors from 12 different school districts. The program began with approximately 40 students in the first year of the pilot program and currently has 230 students registered. The objective of the TBI is to prepare students for a career in a medical field by raising the level of math and science education through exposure to advanced college courses in a medical setting. A longtime partner of the healthcare industry, Temple College provides post-secondary educational opportunities which provide the technological skills and knowledge to work in a number of biotechnology and health services fields. The award-winning Clinical Simulation Center enhances the education at all levels, including Temple College's certificate and associate degree health profession students, Texas A&M University College of Medicine medical students, Scott and White Hospital residents, fellows, and practicing physicians and nurses. The Clinical Simulation Center has received the Texas Association of College Technical Educators Presidential Award for Excellence, as well as being named a finalist for the prestigious Bellwether Award. The Temple campus of the Texas A&M Health Science Center College of Medicine is headquartered on both the Scott and White Hospital and Veterans Healthcare System campuses. Medical students receive training in basic sciences for the first 2 years, followed by 2 years of clinical education. The variety of clinical experiences allows students to identify their own focus or specialty area in medicine. Clinical training takes place at the college's primary clinical facilities, Scott and White, Central Texas Veterans Healthcare System, and Darnall Army Medical Center at Fort Hood. Education in action, empowering for tomorrow. Through research, new medical knowledge is generated, and as a result of these discoveries, new treatments are made available to patients. Ultimately, those treatments provide benefit to patients throughout Central Texas and beyond.
The role of the Temple Health and Biosciences District with regard to research is in several capacities. On the one hand, when we want to bring in new, bright, young scientists to make new discoveries here at our institutions, we want to show them that the community is committed behind it. Second, for people that are doing research, many of them would like to see their discoveries translated into new drugs and new therapies, new diagnostics that can help patients. Third, the Temple Health and Bioscience District is bringing together all of the players in the community so that if healthcare studies are needed, really we are coordinating all of the groups so that they can help test out new discoveries, whether they're diagnostics or therapeutics or new tools to help patients' lives.
With a novel approach that links new discoveries and clinical care, the Cancer Research Institute is working to take bench research to bedside treatment. Several projects are already in progress, which are working to yield potential treatments for melanoma, leukemia, brain tumors, lung cancer, and other diseases. At the Institute of Regenerative Medicine, researchers use adult stem cells to develop new therapies to combat osteoarthritis, diabetes, Parkinson's, spinal cord injury, stroke, Alzheimer's, cardiac, kidney, and pulmonary diseases. The Institute also provides academic programs for career development and job training and serves as an engine of new scientist development for Texas. The Cardiovascular Research Institute is a joint effort of the Texas A&M Health Science Center, Scott and White, and Central Texas Veterans Healthcare System. This unique program pairs basic research on the heart, blood vessels, and lymphatics with clinical applications for the treatment of people suffering from cardiovascular disease. CVRI scientists have made significant discoveries in the areas of blood vessel and heart function, angiogenesis, edema, inflammation, heart failure, atherosclerosis, ischemic heart disease, hypertension, and diabetes. The rapidly expanding capacity for research discoveries on the Temple campus begs for an opportunity to apply these new discoveries to the direct benefit of patients. The vast number of patients cared for at Scott & White and the Veterans Hospital makes Temple an ideal setting to conduct clinical trials to test the safety and effectiveness of new drugs, devices, and procedures in the care of patients with a wide variety of illnesses, including diabetes, cancer, heart disease, childhood leukemia, crippling arthritis, and neurological disorders such as Parkinson's and Alzheimer's disease. Research in action, changing the future of healthcare.
Temple's a very fortunate community that we have a solid economy that's based upon manufacturing, distribution, and healthcare. And historically, the three parts of that stool have done well. What we have focused on in the Bioscience District's economic development effort is strengthening the healthcare component through helping with medical education, medical research, and ultimately where we're heading today is to the commercialization of that research.
The Bioscience District's work in our job sector and in providing higher paying, good quality jobs has been very beneficial. We have a range of jobs in this community from retail to manufacturing to distribution and many more. But our healthcare jobs and our bioscience related jobs are among the best and the most sought after, not just in this community, but across the country. And so the Bioscience District's work in that area is very significant and very important.
The Texas Bioscience Institute, which quite frankly was a direct result of the Temple Health and Bioscience District, is an effort in education to look at where are our employees, where are our future employees, and how do we get them through the education pipeline. One of the areas that we saw as a real opportunity for Temple was in our high school students. And so we have, out of the Texas Bioscience Institute, high school juniors and seniors from about 14 different high schools in the area that can complete an associate's degree before they graduate high school.
The Temple Bioscience District was a key factor in our moving my laboratory from Tulane and New Orleans to Temple, Texas here. I moved with some 17 people. We're now up to 35. We're planning to have 70 people in the laboratory, much as we had at Tulane. It's a tremendous job in developing this building for laboratories and for a school for technicians, whom we need very much. As we begin to do our research, we're trying to move to new therapies for people. We're trying to move, for example, to develop a new therapy for diabetes. For that, we have to begin thinking about not just treating one or two patients, but treating perhaps hundreds of thousands.
As they continue their research, the plan is that we will be able to parlay the results from that research into industrial type applications where we can have converted into some production capabilities, and the companies that will be located in our new research park that is just to the west of the Scott & White West Campus will be the perfect location to make that transition from research into production.
Vision without action is a dream. Action without vision is simply passing time. Action with vision is making a positive difference. Temple Health and Bioscience District. A better tomorrow, today.